Our group will talk about condition 2, Gjerke disease. We will talk about who is usually affected and what is the cause of this disease, which biochemical pathway is associated with this disease, what symptoms are experienced by the patient, and how are they related to the affected biochemical pathway. What kind of dietary changes might be needed for patients with this disease and glycogen storage disease type 1, as known as von Gjerke disease. It's an autosomal recessive disease characterized by the deficiency of enzyme glucose 6-phosphatase, and hence disrupt the breakdown of glycogen to glucose. As a consequence, glycogen gets accumulated inside the liver, and this affects the body's ability to maintain blood glucose level in times of fasting, starvation, or intense physical activity. Von Gjerke disease is an inherited disease with an annual incidence of about 1 to 100,000 live births. Symptoms of this disease often appears in babies around 3 to 4 months, and it occurs due to gene mutation in two genes. The G6PC, the gene which provides instruction for making an enzyme called glucose 6-phosphatase, and SLC3784, the gene which provides instructions for making a protein called glucose 6-phosphatase translocase. At the membrane of the endoplasmic reticulum, glucose 6-phosphate translocase works together with the glucose 6-phosphatase protein to break down glucose 6-phosphatase. However, mutation in these two genes prevent the effective breakdown of glucose 6-phosphate to glucose, which is the main source of fuel for our cells. This buildup of glycogen can be toxic and damage organs and tissue throughout the body, especially the liver and kidneys. The disease are passed down from parents to children. However, in most cases, parents don't show any symptoms of the condition. An individual is more at risk if they have a family member associated with this.
Glycogenolysis is a biochemical pathway which involves the breakdown of glycogen to glucose. Glycogen is stored energy in the form of a long chain of glucose, and glycogenolysis takes place in the muscle and liver cells, where more energy needs to be produced. Therefore, glycogenolysis occurs when ATP levels are low and there is low glucose in the blood. It sort of acts as a way of freeing up glucose and occurs when more energy is needed in the body. The process of glycogenolysis forms one molecule of glucose 6-phosphate, leaving the remaining chain of glycogen with one less molecule of glucose. This process is repeated several times so that multiple glucose molecules can be removed from the chain. This can be seen in the image where the core protein of glycogenin, located in the center, is surrounded by branches of glucose residues. Glycogen has several non-reducing ends and one reducing end, with the glucose molecules being added to the non-reducing ends of glycogen. It requires three enzymes, first being glycogen phosphorylase, which phosphorylases glycogen to glucose 1-phosphate, debranching enzymes that facilitate phosphorylase, and phosphoroglucometase, which converts glucose 1-phosphate to form glucose 6-phosphate. Second being glycogen debranching enzyme, which removes glycogen's branches, which makes additional glucose residues accessible to glycogen phosphorylase. And lastly, phosphoglucometase, which also converts glucose 1-phosphate to glucose 6-phosphate. In von Gjerke's disease, there is an incapability for the liver to break down glycogen into glucose, which is caused by an absence of the glucose 6-phosphatase enzyme. Glucose 6-phosphatase works by removing the phosphate off the 6-carbon, thus releasing free glucose into the bloodstream for the rest of the body. As a result of this enzyme not working, glycogen gets accumulated inside the liver, and this affects the body's ability to maintain blood glucose levels in times of fasting, starvation, or intense physical activity. In addition to hypoglycemia, it can also result in lactic acid conditions and include symptoms such as seizures, rounded face, and full cheeks. Suitable dietary changes decrease the metabolic abnormalities of the disease and the risk of chronic complications. As von Gjerke disease prevents the body from breaking down glycogen, there are many symptoms that come with this, which usually appear in an infant at 3 to 4 months old. Affected individuals can have a range of symptoms such as delayed puberty, osteoporosis, or having excess amount of fats in the blood. One of the most significant symptoms, however, is hypoglycemia. When we consume food, the excess glucose is stored in the liver in the form of glycogen, which is broken down by the body as needed. However, as stated previously, people with von Gjerke disease have a deficiency in the glucose 6-phosphatase enzyme and thus have an inability to break down this glycogen. This in turn means that they are unable to maintain a healthy blood glucose level, which will result in hypoglycemia. This can result in mild effects such as confusion and fainting, or in more severe cases may cause a person to have seizures, fall into a coma, or potentially die. This condition leads to the majority of symptoms experienced by people with the disease. These can include the following. Infants may experience slower growth than normal as they are hindered in their developmental stages due to their lower blood glucose levels. This can result in potential intellectual disabilities. An individual with hypoglycemia can also suffer from weak muscles and muscle pain. This is due to a lack of glucose being produced by the liver that is involved in muscle activation. Constant hunger is another symptom. As there is not enough energy being produced by the body because of the lack of blood glucose, an individual may feel a sense of constant hunger as the body attempts to consume more to stimulate glycogen breakdown. The next symptoms are noted as the disease progresses. As more food is consumed, glycogen continues to be stored without being broken down. This results in a gradual buildup that in turn causes the liver to swell. Luckily, the liver remains relatively unaffected and is still able to perform many of its functions as normal. This buildup will also lead to swelling in the kidneys, as they are also involved in the storage. This swelling will cause one of the many signs of the disease, as the abdomen begins to protrude as it's pushed forward.
Patients with von Gjerke disease are restricted to a diet that avoids the consumption of foods that contain fructose and galactose. It is important to limit the intake of non-usable sugars to prevent increased glucose levels. Blood glucose can be maintained within the normal range during the daytime, with an optimal dietary intake spaced at 2.5 to 3.5 hour intervals. However, glycemia may still occur during overnight fasting. Dietary requirements include only 1 serving of dairy per day, only white, rye, or wheat bread, white potatoes, no sweet potatoes, no fruit, only lemons, limes, and avocados, no trans or saturated fats. Eating cornstarch with every meal is a method of slowing down digestion and keeping blood sugar levels within a normal range. Diagnosing a patient can be achieved after analyzing how the patient's liver cells function when added to the substrate. The production of the blue complex indicates that the enzymes glucose 6-phosphate is present in the liver and functioning as normal. Therefore, the patient does not have von Gjerke disease. The lack of blue complex would indicate deficient activity of the enzyme, and the patient would be diagnosed with von Gjerke disease. Using this table, we can correctly diagnose a patient or determine whether the assay was faulty and needs to be repeated for a further analysis. The spectrometer possesses the risk of being faulty or inadequate at low sample concentrations. The liver cells may be influenced by temperature, pH, or contaminants, which will affect the absorbance level. Working with liver cells may cause a sampling error, and it is highly important to keep the specimens fresh and stored in an appropriate environment. Another limitation is that the glucose 6-phosphate substrate that we use in this experiment is a substrate for many different enzymes, and glucose 6-phosphatase is not the only enzyme that may act on it.
There is a possibility that during the assay, other enzymes may act upon the glucose 6-phosphate, which will cause other reactions and lead to a false positive or false negative result. Other techniques for diagnosis of von Gogh disease may be through gene testing, which takes a DNA test to look for the mutation on chromosome 17. Molecular genetic testing is based on levels of glycemia, lactidemia levels, and if the uric acid, cholesterol serum, and triglyceride levels have increased, this indicates that there is no glycemic response to glycogen, which confirms the disease. An abdominal ultrasound may be used to detect the size of the liver. If it is enlarged, this is an indicator that the enzymes on the liver may not be breaking down the glycogen as needed.
And these are our references.